pioneer CMD of FTH, Federal Teaching Hospital, Katsina, by Fadama All-Stars Social Club, Katsina. Award of Excellence Leadership and Humanitarian Service presented to Dr. Suleiman B. Is the pioneer CMD FTH Katsina for your exemplary leadership and humanitarian service to the community and beyond.
I remember my teacher, the man that trained me. So, blessed memory now, Professor Adeoye Adini is a emeritus professor of pediatrics, the father of quantum management property at the University of And I recall one time while we were in the special care unit at the University of Technology Hospital, I was a senior registrar. And he told me, Suleiman, do you want to succeed? And I said, of course, sir. And he told me, just do the work that you're doing. Whatever your work you're doing, do it with all your strength and don't rest until it is done. And that is the recipe for success. All I'm doing is I'm doing the work that I'm doing. This hospital is a federal tertiary hospital, and it was established for three main reasons. One is the key reason why the hospital was established: service delivery. The remaining two reasons are there to support number one reason: training. When we train resident doctors and they become specialists, we get better service delivery. The research, when we carry out the research, we find better ways of doing the things that we do, and it translates into better service delivery. So all we're doing is we're going back to service delivery. How do we serve the multitude of patients that come into this hospital? And like my chairperson, Haja Hanifa, always does it. We had the first meeting we had after she was appointed to chairperson. She told me then I was MD before I became CMD. She told me, MD, whatever is right for the patient is right. Whenever the patient is not happy, then whatever it is that you're doing is not right. Always do what will make the patient feel happy, what will translate into happiness to your patient. And effectively, I think that's all that we're doing. We're trying to make life easy for the patient and to make it better for the patient. Now, one thing our health system has not done for us in Nigeria is that we are about maybe the only country now in the world, because even other African countries have moved ahead of us. Rwanda, Kenya, Ethiopia, they've all moved ahead of us in terms of this. We're about the only patient in the country, when you have an emergency, you go to the hospital, you have to bring out money and pay out of pocket. All other countries in the world, if it's an emergency, they're taking care of. If it's elective, if it's not an emergency, that is when you have to stop yourself. But for all emergencies, the system tries to take care of you because nobody is warned. That's why it's called an emergency. It's an accident. It just happens. And it can happen to you. For the well-to-do, like my friend, the manager of the team, he always has money in the bank account, so he can always take care of business. But there are some of us who go what we call Tasha Sahabai in one in Hausa. The Sahabis are like the companions of the Holy Prophet. So we normally call it like that, and you wake up just like the companions of the Holy Prophet. You wake up without knowing when the next thing is going to come. You don't sleep with the kobo, and you wake up without the kobo. And so in such a situation, when an emergency happens to you, you don't have the kobo, and you are now asked to present an emergency and people are waiting for you to bring out money. That is all the system tries to do. How do we provide for our people? How do we utilize the resources that we get to provide service for our people? And like I was explaining to Arise TV the other day, that is what the wallet system that are operating at every day. If you get to an emergency, you don't need money to open the folder. You will be seen, you will be triaged, you will be assessed. If tests need to be performed, they will be conducted. If operation needs to be done, that operation will be done. If emergency drugs need to be served, they will be collected from the pharmacy and will be served, the patient will be served. After we've been able to stabilize and save the patient, we can now start discussing how to do this. Are you insured? Are you under NHIS? Are you under relationship? Do you have anyone that person that can settle your bills? I think that is what the system is trying to do. And so that is all that we try to do. And that we always see. We train not only key mentioned resident doctors. Yesterday, the nurses were telling us that we have almost 80 nurses in training. Because to complement the doctor, most illnesses, people will not know. The determinant of survival is good nursing care. You need a good doctor, but whatever the good doctor will do, without good nursing care, you will lose whatever benefit is gotten. And so the system tries to train not only the doctors, but also to provide nurses to complement them, to provide radiographers and lab scientists that will bring that genuine and reliable results. So everybody, the pharmacists that will do the work they're supposed to do. So whatever we try to do is to see that we provide that human resource, that will provide the training to ensure that the output of the healthcare worker is maximized. And then of course, we now support research, see that we get better ways of doing things that we do. So, not to bore you with all this long discussion, I think that's all that we're trying to do. We're just doing the work that we've been given to do. And I thank you very much for the honor that you've done to me and the fact that you've found me worthy of being given this honor. But let me finally say that I'm not alone. I have the team that is working with me. This is my acting director of administration, Yusuf Abdullah. The chairman medical advisory committee, Dr. Hakim, is currently on leave. His deputy, Dr. Abdullah, unfortunately woke up this morning not feeling very well. So because of that, he's also not there. But this is the deputy of the deputy, Dr. Lawal Mogaji. He is here with us. And then of course the strong house, the leader of the strength of the hospital, the nursing services department, Sulaiman M is here. So we thank you very much and we really do appreciate you. And thank you very much. And may God reward you for the honor.